Hi, I am Dr. Felice Gersh, your integrative OBGYN, here to tell you that words do matter, but they matter depending on what is meant. And what if the meaning of the words you're saying or hearing is confusing? That's why I want to talk about a term that is bantered about and has been sort of involved in a bunch of chatter recently, and that is the expression, guess what? Bioidentical hormones. But I'm going to touch on a few others that sometimes come along for the ride. Okay? So I have used the expression bioidentical hormones. I know you have heard it. You've probably used it. So what does it mean and in what context? So some people, I'll talk about how some people seem to use it. Some people use the expression bioidentical hormones to mean compounded hormones. Now, that actually isn't what it means, in my opinion. I guess we definitely need to know what the majority think, but I'll tell you what I think. It does not mean that it's a compounded formula. Now, compounding means that you get it, the product, the hormone product, from a compounding pharmacy, which makes it to order. So it would be a little like you go to a grocery store bakery, and then there's a row of, say, cookies that are made, but they're made by the baker of the grocery store, and then they're put in different, like, cubbies and so on with the label and so on. But they aren't made for you. They're made for the public, but they're cookies, okay? Now, what if you wanted a special cookie? Well, then you could hire a special pastry chef or baker, and then you could say, I want this very special cookie for my 5-year-old's birthday party. That's wonderful. And it's custom made to you. That's what compounding is. But a lot of people think that's what bioidentical means. So let's go in how some other people use bioidentical. Some people use the expression to simply mean that the hormones in the product can come from a regular pharmacy like CVS or Walgreens or Costco, or it can come from, a mail order pharmacy. But what it has as its ingredients is bioidentical to the hormones produced, and we'll talk about women here, okay, in a female adult's body. Well, that is one way that you can consider the expression bioidentical. Well, what about how I think it should be? Well, for me, bio means life. Identical means, well, it's an absolute match. So in terms of, say, a hormone, we would say a molecular match. Every carbon, every hydrogen, every bond, everything is identical to the product made by the female ovaries. If we're talking about the particular hormones made by the ovaries, estradiol and progesterone, and it could include testosterone, but testosterone is only in the US for women made uniquely by compounding pharmacies because there is no commercial product. So we're going to put testosterone on the back burner, but recognize that testosterone, of course, is made by females, and you could buy testosterone. In this case would be from a compounding pharmacy. For men, it could be from a commercial pharmacy, and it would have the identical molecular structure to what is made in the female body by the ovaries. Now, that is one way that you could think about it. But here's the thing. If you say it's an identical molecular match to what's found in the female body, but you don't say and exactly what's made by the ovaries, then it could be something that is made in the female body from those hormones that are made in the ovaries. So they're found in the female body, but they're not coming out of the ovary. Because remember, these are families of hormones. So estrogens in the female body include E1, estrone, E2, estradiol, E3, estriol. And then there's estradiol, which is E4, which is a fetal liver-produced estrogen, which is never found naturally in the female adult body, but can be put into it through a pharmaceutical company's product. But is that bioidentical? You could have a product like Biest, which is a combination of estradiol, E2, that's what's made by the ovaries, combined with estriol, E3, which is a hormone in the female body, but it's not made by the ovaries. It's made peripherally by conversion of estradiol into estriol. And you can also have Triest, which included the other female hormone, Estrone E1, which is also not made in the ovaries. It's converted from estradiol in the peripheral tissues, or it's made from androgens coming from the adrenal gland. Is that bioidentical? Well, yes, no, depending on what you think you want bioidentical to mean. So what do I want bioidentical to mean? I want it to mean that you give a hormone that is structurally, molecularly identical to what is made by the female ovaries, because that's what we're talking about here. Hormones for women in perimenopause and menopause, okay? Because I'm going to touch on bioidentical hormones of other sorts, just so that you'll kind of get the general picture. So, but I want it to mean that it's identical structurally, molecularly to the hormones made by the ovaries, and the same identical formulation that is delivered into the bloodstream from the ovaries. So why am I having to really say that little bit? Because if you take E2 estradiol and you swallow it, it goes through what we call the first pass through the liver, goes digestion, ends up passing through the liver. The liver is a massive, amazing organ of biotransformation. It converts one thing to another for various purposes, to create enzymes, proteins, to biotransform for the purpose of detoxification and elimination from the body. For example, it can turn a fat-soluble hormone into a water-soluble molecule that can then be transported and go out with the urine, which is essentially like water, so it needs to be water-soluble. So there's a whole bunch of things that the liver can do to all kinds of different molecules, and it transforms most of estradiol into a different estrogen, E1 estrone. So you get a very high percentage of estradiol turning into estrone and then going into the bloodstream as estrone. Now, estrone can be converted back into estradiol elsewhere, but it's variable how much that's even going to happen. And it also is reduced in that conversion back into estradiol from estrone if you have a lot of inflammation, which downregulates the enzyme that makes that conversion. So you have to assume if you swallow estradiol, which is technically a hormone that is molecularly identical to what the ovaries make, but it's not going to go into the bloodstream as that hormone. So I like to think of bioidentical as it not only enters the body as the identical molecular structure to what the ovaries make, but it also enters into the bloodstream as that identical molecular structure. It doesn't go through the digestive tract to be converted by the lining cells of the intestine, the liver, into another form of estrogen in this case. And we'll talk about progesterone in a second. So if you want to have identical molecular hormones structurally to what the ovaries make, and you want estradiol, the only way that I would recommend it for systemic administration would be transdermal through the skin. Now, granted, okay, you can get molecular identical estradiol into the bloodstream through pellets and shots, but you will not get what I also include in my bioidentical definition, that you get bioidentical levels and rhythms to what a normal, healthy, reproductive age female would have to a reasonable degree. We're not talking about an exact, but in the ballpark. We'll just say it's ballpark medicine, not precision medicine. And therefore, you get levels that would be found in a normal, healthy, reproductive age woman. Menstrual cycles are very complicated. You already probably know that if you've listened to me. And the levels of hormones are not static, they do fluctuate. It's very complex, and we haven't gotten to the point yet of being able to master replicating all of that. Someday, perhaps, and we have no published data yet, but we can at least get levels that are in a healthy female reproductive range, which is still a work in progress. And there's research being done a little bit looking at that, but not enough. But we do know what women in the reproductive years have in terms of ranges of levels of these hormones. And that's where I want to be, at least in that range. So that's part of my bioidentical. You want to have going into the blood the identical molecular structure of the hormone that the ovary is delivering into the blood. And you want to get it in with levels that are consistent in the ballpark with levels that healthy reproductive women would have. And you could say, well, why are you including the healthy reproductive age levels? Because that's how females were evolved. If you want to be optimally healthy, you want to have levels of hormones that are in alignment with being optimally healthy. Remember, what do hormones do? What's the point? They give information to the cells to tell them what to do. You want to have the right instructions, whatever your age. You don't want to give wrong instructions just because you're 56. You still want to have the same instructions. You want to have the same support to your mitochondria, to make growth factors, to make nitric oxide, to control your immune system. We can go on and on, okay? You need levels that are consistent with human bioidentical because dose matters, like in everything. So that's part of my definition of bioidentical. Now, I've been focusing a lot on estrogen. So what about progesterone? Well, progesterone should always be given as part of menopausal hormone treatment, or what I prefer, the old term. What is that? HRT, hormone replacement therapy. Even those terms are confusing. So before I get into progesterone, let me just talk about those terms for a minute. What is menopausal hormone therapy, MHT? I don't know. It's just hormones for women in menopause. It doesn't say how they're given, what they're given, if they are bioidentical, not bioidentical. Is it just vaginal estrogen? What type of estrogen? To me, that word, that expression, just means you're giving hormones to a woman in menopause. But not everybody even thinks of it that way. Some people think it means you're giving a tiny dose of static estrogen, usually with a patch, and a nightly dose of progesterone, usually 100 milligrams. By the way, that's not a regimen I ever recommend, but that is very commonly used. And a lot of people think that's what the definition means. So I think we better be careful with our words. Now, I prefer the old term, which is still used in many places in the world, HRT, hormone replacement therapy, because that's how I think of it. I'm not just giving hormones for the sake of giving hormones, some kind of hormone, because we know estrogen is a family of hormones, progestogens are families of also progestogens. That includes progesterone, but not only progesterone. All of those types of hormones could be included in menopausal hormone therapy. But in my view of HRT, the way I would use these words, hormone replacement therapy, the goal is to replace the hormones that have now left the scene because the ovaries are no longer capable of making those hormones, estradiol and progesterone, and so you are replacing them. You're not just treating symptoms, you're truly replacing the hormones to replace what is needed, the exact same hormones the ovaries made reasonably with the similar rhythms and levels. Hormone replacement therapy, not menopausal hormone therapy. We're not just trying to reduce symptoms, which I'm not saying doesn't have value, but for many of my patients, maybe for you, I do not know, just suppressing symptoms isn't enough. They want, and I want for me, doses and rhythms that are optimal for optimal health. That's what I want from HRT, hormone replacement therapy, with bioidentical hormones. Now, bioidentical hormones for me means human bioidentical. And I'm going to come back to that. I don't want to forget why I think that we need to actually put in the word human. Okay? So let's just touch on progesterone and progestogens. So I was listening to a recording just this morning where a very respected practitioner, an MD from a major university academic center, misused the word progesterone when what was really being referred to was medroxyprogesterone acetate. When those kinds of mistakes are made, it really breaks my heart when someone in a really high up, respectable position actually misuses the word. So it's really important that you make sure that when you hear these words, that you find out what they're really talking about. Because if you want bioidentical progesterone, then you need P4. That's the symbol and number for bioidentical progesterone. Because, like the Women's Health Initiative study, which did not use human bioidentical hormone, it used conjugated equine estrogen, an estrogen that came from a pregnant horse's urine. The horse had already conjugated it, changed it, so it became water soluble, so it could go out the urine. The horse was trying to get rid of it, the pregnant horse. It contains a whole variety of hormones natural to a pregnant horse, never found in a human being ever. And when it's taken orally, many of the estrogens stay as horse estrogens, never to be ever found in a human body, but now in a human body, along with what is oral estrogen. Human estradiol turns into estrone, E1, which has totally different binding properties, primarily binding to the alpha receptor and having a more proliferative pro-inflammatory effect. So that's why we don't want that. We want estradiol, the same estrogen made by the ovaries during the reproductive years. But a lot of people talk about progestins and progestogens and then act like they're progesterone. In the Women's Health Initiative, I mentioned the estrogen. What about the fake mimicking progesterone, which was medroxyprogesterone acetate? It sounds like it's like progesterone. It has the word in it. It's a totally different molecule. Remember, even a little change to a molecule can have huge effect changes in the human body. If you just think, I always use this as an example, H2O is water. Very good for you when it's, pure, wonderful water, H2O, but you add an extra oxygen, now you have H2O2. Uh-oh, that's hydrogen peroxide. That's poison. You don't want a glass of hydrogen peroxide. All you're adding is one oxygen. When you have something like medroxyprogesterone acetate, you're adding more than one element. You're adding molecules. You get a totally different binding effect, different effect in the body, and it's not going to have the effect of progesterone, P4, which is the human-produced progesterone by the ovaries. Now, I said I would like to use the word human because way back, if we go back to the 1940s, someone came up with the bright idea for women who had really bad problems with menopausal symptoms to take cows' ovaries and grind them up and give them to human females. Well, you're going to get some cow estrogens into females that way. Then we move forward. They developed the conjugated equine estrogens by concentrating into a tablet the pregnant horse's urine that has the equiline estrogens that they then called conjugated equine estrogen. Okay, so bioidentical, and sometimes that's mixed with the word natural, can apply to thyroid hormone. I just wanted to throw this into the mix because there are types of thyroid hormone that are marketed for treatment for hypothyroidism that are desiccated thyroids. Now, what is that? It's dried up, ground up pig thyroid gland. Now, when you go back in time long ago, before we had human bioidentical insulin, if you had type 1 diabetes, well, before anything, you were a kid, you got type 1 diabetes, you died. Then they discovered you could get insulin from a rabbit, and it worked kinda, not that great. After a while, they would make antibodies against it because it's a foreign protein. And then, miracle upon miracles, brilliant people figured out how to make human bioidentical insulin. Brilliant people figured out how to make human bioidentical T4 thyroid hormone. So we don't have to use ground up ovaries. We don't have to use urine from a pregnant horse. We don't have to use ground up pig thyroid glands. We can actually have, in the whole world of endocrinology, right, and hormone therapy of different types, human bioidentical molecular hormones that are made in a lab. They're not coming off a tree, but they're bioidentical for the human hormone. But then they say they're not natural. Well, they're natural once they're made in the human body. The other hormones I talked about, thyroid from a pig, estrogen from a horse that's pregnant's urine, ovaries from a cow ground up, those are bioidentical natural products for those creatures, but not for me, not for a human female. It's not going to match what my body should have or was making in the past or does make today. Okay, so when I want to talk about bioidentical, I mean human bioidentical. So I think we need to include that word as well. So, in summary, explain what you're talking about. If you say hormone therapy, are you saying it's human bioidentical, molecularly identical to what the ovaries make, and it's entering the blood in a bioidentical molecular formulation? It's not being converted by the liver, that it's in the same reasonable range of levels consistent with a healthy reproductive age female? What are you talking about? Are you talking about giving hormones at a level that would be considered inappropriate for any human female who's young? Are you talking about giving progesterone every night orally in a way that is completely incompatible with the way human evolution has occurred for females to get hormones? And in talking about oral estrogen, which I touched on, how it's converted predominantly into estrone, what about progesterone? When you take oral progesterone, it goes also through the first pass through the liver, through the digestive tract, and 80 to 90% of it is converted to a metabolite, to other stuff. The main one being allopregnanolone, which is a natural molecule in the human body, male and female. It's converted from progesterone, a lot of it in the brain. That's why allopregnanolone is a neurosteroid. But when you get it orally and it goes through the liver, you get a huge abnormal quantity, depending on the dose of progesterone, anywhere from 2.5 to 5 or higher times the maximum level a human female would ever have in her body. Plus, you will typically get much lower levels of progesterone, since most of it, 80 to 90% of it, is converted to allopregnanolone. So that, to me, is not bioidentical. You're not getting the identical product of the ovary into the blood. You're getting a little progesterone and a lot of allopregnanolone, much more than natural. So to me, taking oral progesterone is not aligned with my definition of human bioidentical delivery system of hormones. So my definition of bioidentical, it has to be identical to human female hormones in the adult female, not in the fetal liver, not from a fetus. It has to be entering the bloodstream as the hormone exactly what the ovaries would make in a reproductive age female, and it has to be coming into the female body in alignment somewhat with the levels and rhythms of a healthy reproductive aged female, if you're really going to use the term correctly, bioidentical, and preferably put the word human just so it doesn't get confused with these different hormone products that come naturally, you say natural, but from a different creature with molecules never found in humans. So, bioidentical, a challenging little expression. I hope you'll think of my definition. And anytime you hear somebody using it, just say nicely, what do you mean? What are you saying?